Thank you very much, Mr. Speaker. My question is to the Premier. Last April, the Premier made a promise to Ontarians. She said, and I quote, she would not cut education. Well, we've seen teachers fired, schools closed, and families thrown into chaos. In fact, just last week, Windsor families saw and learned that 21 early childhood educators were being fired. People didn't vote to see their schools closed and teachers fired. Will today's budget reverse these cuts?
Well, Mr. Speaker, and I know the Minister of Education is going to want to speak to the specifics, but let's just be clear, Mr. Speaker, the funding for education has not been cut. It will not be cut, Mr. Speaker. And in fact, if the member opposite had an opportunity to look at the grants for student needs, which is actually the section of the budget that applies to education, those numbers are already in the public realm, Mr. Speaker. He would see that despite the fact that there are fewer students in our education system, Mr. Speaker, the funding has remained stable, which in fact means that there is more money per student in the system, Mr. Speaker, this year than last year.
Thank you, Mr. Speaker. In fact, the Premier made another promise. She said she would not cut health care. Yet, I would ask the Premier to tell that to the 17 RNs who were fired from South Lake Regional Health Centre, the 50 nurses fired in Ottawa, the 11 nurses that are being fired in Thunder Bay, and to the seniors who are losing 28 beds in that region. Ontarians didn't vote to see nurses fired or hospitals closed. Will today's budget reverse those cuts? Good question.
Minister of Health and Long-Term Care.
Minister of Health and Long-Term Care.
Well, thank you, Mr. Speaker. And Mr. Speaker, the member opposite, that whole caucus knows that the truth is that there are 24,000 more nurses employed in this province than were a decade ago, and we continue to employ nurses and other healthcare professionals. My critic, of course, the member from Nickel Belt yesterday, scared the heck out of a lot of people when she said the Lake Ridge Health Centre was letting go of 20% of their genetic technologists, laying off senior technologists. These positions, she said, have a direct impact on the patients at Durham. The truth, in fact, is the complete opposite of what she said. And in fact, the hospital in question was so irritated by her response in the legislature yesterday, they're issuing a letter today to correct the record. She's talking, first of all, and I hope, Mr. Speaker, I hope I have the opportunity in the supplementary to actually address this more specifically.
Thank you. Final supplementary.
Thank you very much, Mr. Speaker. Ontario drivers pay the highest.
I would like order, please. Start the clock. Final supplementary.
Ontario drivers pay the highest auto insurance rates in Canada. The Premier told Ontarians that they would see a 15% reduction in auto insurance by this August. But with 4 months to go, the Premier is not even halfway there. The Premier promised not to cut health care, but we've seen nurses being fired and hospitals being closed. The Premier promised not to cut education, but we see teachers being fired and schools being closed. The Premier promised to reduce auto insurance by 15%. Yet we've not seen that yet.
Stop clock. Associate Minister of Health and Long-Term Care, the member from Newmarket, Aurora, and I probably got 4 more that I'm going to come and get you. That's enough. Please finish.
The Premier promised to provide a 15% reduction to auto insurance. Will today's budget ensure that Ontarians get the reduction that they were promised?
Mr. Speaker, I'm prepared to go through this one hospital at a time if they want to. I'm going to give the member the opportunity as well to correct his record when he said we're closing hospitals. There's not a single hospital that's closing around this province unless we're building a new one to replace them, Mr. Speaker. Mr. Speaker, back to Lake Ridge Hospital. She was talking about 3 people. The hospital has said they disagree that patients will be impacted. In fact, they said technology has changed. They now use University Health Network Lab for better tests and faster results and better quality. All 3 still have jobs. One at the hospital, one at University Health Network.
From your own side, I want to hear the answer, and from this side, the member from Dufferin-Caledon will come to order. Final question. And the Minister of Aboriginal Affairs is warned. The injections are not appreciated.